Multiple sclerosis, understanding your diagnosis and live a healthier life. Written by Quinn Spencer, narrated by Eric Boozer. What is multiple sclerosis? Multiple sclerosis is a chronic illness of the central nervous system, which has effects on the body's defense system. People that have passed the age of 30 usually develop multiple sclerosis, and there are much more women than men suffering from the disease. More than 1 million people are affected by multiple sclerosis. The central nervous system is made of the brain and the spine, and without it, the body couldn't live and think, because it processes the signals transmitted by the nerve endings that are spread all over the body and responds to them. Multiple sclerosis affects this process and therefore interferes with our abilities to taste, smell, touch, and feel everything. The nerves of the central nervous system are surrounded by a membrane called myelin. This membrane is affected by multiple sclerosis because it makes the central nervous system attack it by sending the antibodies and the white blood cells against it. White blood cells and antibodies are cells that have the purpose of fighting bacterial and viral infections. Whenever a dangerous foreign microorganism enters the body and it starts an infection, the central nervous system sends the antibodies to destroy it. Multiple sclerosis confuses the central nervous system and makes it send the white blood cells against the myelin. They attack it, and then the nerves become defective. In time, multiple sclerosis completely blocks the nerve signals and seriously affects the senses. Multiple sclerosis causes are not entirely known. Researchers are still studying what the causes of the antibodies attacks are. MC may have a genetic cause, but this is not sure yet. The symptoms of multiple sclerosis are very different from one patient to another, depending on what senses are affected. Here is a list of general symptoms that may appear. Complete or partial temporary loss of vision. Vision often gets blurry or double. Confusion, fatigue, weakness, dizziness, tremors, abdominal movement, balance loss, muscle atrophy and spasticity, hand or leg paralysis, incoherent speech. These are just a few of the symptoms. Each patient presents particular symptoms because there are a lot of nerve endings in the body, and each one can be affected and shows a different symptom. Factors suspected of causing multiple sclerosis. Although the exact causes and risk factors of multiple sclerosis are still unknown to modern medical science, it is believed that the disease occurs on the premises of inherited genetic dysfunctions and is triggered by certain environmental factors, either exposure to chemicals or infections with viruses or bacteria. Despite the fact that medical scientists have concluded elaborate research on multiple sclerosis over the last few years, the exact genes that render people more susceptible to developing the autoimmune disorder and the exact environmental causative agents haven't been identified yet. Medical scientists hope that in the near future they will be able not only to discover the exact causes of multiple sclerosis, but also find efficient means of preventing the occurrence of the disorder in persons with predispositions to autoimmune disorders. According to recent studies in the field, genetic factors play a major role in the occurrence and progression of multiple sclerosis. Medical scientists informed that multiple sclerosis has a pronounced hereditary character, the genes that render people susceptible of developing the disorder being transmittable from one generation to another. Recent medical research has revealed the fact that the identical twin of a person diagnosed with multiple sclerosis has a 30% chance of developing the same disorder at a certain point in life. The risk of first-degree relatives of persons with multiple sclerosis to develop the disorder is 50 times higher than that of persons with no family history of multiple sclerosis. Medical scientists are currently working to identify the exact genes that render persons with a family history of multiple sclerosis susceptible to developing the disorder at a certain stage in life. Medical scientists believe that infections with viruses are also potential causes of multiple sclerosis. This belief is supported by the unequal geographic distribution of the disease. Cases of multiple sclerosis are more numerous in regions of the globe confronted with regular cases of viral diseases. In addition, scientists have established a link between multiple sclerosis and viral epidemics. According to the results of medical investigations, the overall number of multiple sclerosis cases increases during viral epidemics. In addition, certain viruses are very similar to myelin, the protein that is primarily affected by multiple sclerosis, and it is thought that such viruses confuse the immune system, determining its antibodies to target the body's healthy nerve cells covered in myelin instead of the intruding infectious agents. The infectious organisms that are suspected to play a role in the occurrence and progression of multiple sclerosis are herpes viruses and Chlamydia pneumoniae bacteria. The HHV-6 subtype of herpes virus that causes rosella in children, has also been identified to cause severe diseases of the nervous system, such as encephalitis, brain inflammation. Other subtypes of herpes viruses, such as herpes simplex 1 and 2, varicella zoster virus, and cytomegalovirus, also have potential of causing dysfunctions of the nervous system. Chlamydia pneumoniae, an atypical bacterium that has been linked with various inflammatory diseases, is also suspected to cause multiple sclerosis. Although medical research continues, signs of infection with Chlamydia pneumoniae have been revealed in the majority of patients with multiple sclerosis. Other potential causes of multiple sclerosis are physical traumas, injuries at the level of the spinal cord, as well as emotional stress. Recent studies have revealed that the symptoms of multiple sclerosis are amplified on the premises of emotional stress. Common criteria of multiple sclerosis diagnosis. Multiple sclerosis is an inflammatory neurological disease which generates a wide symptomatic spectrum. Multiple sclerosis primarily affects the central nervous system, interfering with the normal activity of the nervous cells. Multiple sclerosis involves deterioration of the neuron's myelin, a very important substance that facilitates the transmission of nervous signals between nervous cells. If myelin is affected, the connections between neurons are compromised, and the body fails to respond promptly to external stimuli. Multiple sclerosis can cause various dysfunctions in different regions of the body, causing a wide range of physical, neurological, and psychological manifestations. The deterioration of myelin can affect the body's motor functions, causing difficulty walking, loss of dexterity, poorly coordinated moves, loss of balance, sensorial functions, causing decreased visual acuity, altered perceptions of external stimuli, and cognitive functions, causing poor mental performance, loss of concentration, and even memory loss. In some cases, multiple sclerosis can even interfere with the normal activity of the internal organs, causing renal affections and disorders of the gastrointestinal tract. Due to the complex nature of multiple sclerosis symptoms, it is virtually impossible to diagnose the disease relying solely on patients' external manifestations. The symptoms generated by neurological diseases have an unspecific character, thus making the process of multiple sclerosis diagnosis even more difficult. Hence, multiple sclerosis can be correctly diagnosed only after performing elaborate physical examinations and various laboratory tests. Multiple sclerosis diagnosis involves the accumulation of various suggestive data through the means of specific medical procedures and laboratory analysis. The first step in the process of multiple sclerosis diagnosis usually involves the examination of patients' motor functions. People with this type of neurological disease generally have trouble walking and maintaining their balance. Loss of dexterity, muscle weakness, and poorly coordinated moves are also suggestive signs for multiple sclerosis diagnosis. Furthermore, sensorial dysfunctions such as decreased vision are very common to people with neurological diseases, and an important multiple sclerosis diagnosis criterion involves looking for signs of internuclear ophthalmoplegia, double or blurred vision. The process of multiple sclerosis diagnosis often involves MRI scans and lumbar puncture. MRI scans, magnetic resonance imaging, are an important step in confirming the multiple sclerosis diagnosis. MRI scans verify the integrity of the nervous system, using magnetic waves for generating pictures. If MRI scans can sometimes be inconclusive in the process of multiple sclerosis diagnosis, lumbar puncture is a reliable criterion in verifying the presence of neurological disease. Through the means of lumbar puncture, doctors are able to inspect the state of the spinal cord fluid, checking for evidence of inflammation at the level of the nervous system. Neuropsychological tests are also very important in the process of multiple sclerosis diagnosis. The aim of these tests is to find evidence of compromised mental performance due to destruction of myelin. Most patients with neurological diseases often suffer from poor concentration, decreased judgment, and even short-term memory loss, and the main purpose of neuropsychological tests is to reveal the presence of these symptoms. Another important step in establishing the multiple sclerosis diagnosis involves looking for signs of depression, as more than 80% of people affected by this type of neurological disease eventually become depressed. Multiple sclerosis diagnosis is very complex and requires various medical procedures and tests for revealing conclusive signs of the disease. Most patients are diagnosed with multiple sclerosis only if more than 2 specific tests confirm the presence of neurological dysfunctions. Common symptoms of multiple sclerosis. The symptomatic spectrum of multiple sclerosis can be very diverse, involving different manifestations according to the affected body regions. Multiple sclerosis is an inflammatory neurological disease, causing dysfunctions mainly at the level of the central nervous system. Due to the fact that multiple sclerosis affects the nervous system, people with this form of neurological disease can in time experience symptoms in most innervated regions of the body. Multiple sclerosis involves damage of the nervous cells, destroying myelin, a substance that normally covers neurons. Myelin has a vital role in transmitting nervous impulses throughout the entire body, establishing connections between the neighboring nerve cells. When the layers of myelin are affected, nerve impulses travel at reduced speed between neurons and the body is unable to adequately respond to external stimuli. The symptoms of multiple sclerosis are diversified and they can be perceived in different regions of the body. Most patients have individualized symptoms of multiple sclerosis, and they tend to occur in episodes or flares. The evolution of multiple sclerosis is unpredictable, alternating between stages of remission and stages of relapse. Most people with multiple sclerosis experience intermittent, recidivating symptoms, which amplify in the stages of recurrence. Considering the fact that the symptoms of multiple sclerosis are various and at certain stages of the disease unspecified, multiple sclerosis can't be diagnosed only upon clinical manifestations. Multiple sclerosis is usually diagnosed upon laboratory tests, blood analysis, and elaborate neurological examinations. Common generalized symptoms of multiple sclerosis are pronounced fatigue, body weakness, sensations of tingling, burning, pain, itching and numbness of the muscles, loss of dexterity and coordination body movement. Other physical symptoms of multiple sclerosis are decreased vision, loss of mobility, shaking, spasms, tremors, poor balance, dizziness, vertigo. In later stages of the disease, the symptoms of multiple sclerosis can include partial paralysis, renal and gastrointestinal dysfunctions. Neuropsychological symptoms of multiple sclerosis are mental confusion, altered, inaccurate perceptions, poor concentration, short-term memory loss, comprised judgment and unpredictable, sudden changes of mood. A symptom of multiple sclerosis that commonly occur in people with this form of neurological disease is depression. Most people affected by multiple sclerosis eventually become depressed and avoid any kind of interaction with other people. Although many symptoms of multiple sclerosis can be very pronounced at certain stages of the disease, they can be alleviated through the means of medical treatment. Medical treatments available today are able to ease the symptoms of multiple sclerosis in the periods of relapse, and in time they can even help the reconstruction of myelin, thus helping patients to recover from the disease. It is important to timely discover the symptoms of multiple sclerosis in order to begin the administration of an appropriate medical treatment before the disease becomes serious. Consequences of myelin destruction in multiple sclerosis. Multiple sclerosis is an inflammatory disease that primarily affects the brain and spinal cord, the central nervous system of the body, or CNS. In later stages of the disease, multiple sclerosis can involve virtually any innervated section of the body parts which contain structures of agglomerated nerve terminations. By affecting the nerve fibers which have the role to transmit signals between the central nervous system and all the innervated organs, multiple sclerosis can cause a multitude of impairments at various levels of the body. When multiple sclerosis involves more parts of the body, the generated symptoms greatly vary in terms of type and intensity, rendering the process of diagnosing the disease very problematic. Although the progression of multiple sclerosis can be efficiently controlled and its produced symptoms can be alleviated, the already existent damage can't be reversed with medical treatments. Thus, the speed and accuracy of diagnosis plays crucial roles in preventing the development of further complications and also increase the efficiency of the specific medication treatments. All the undesirable effects produced by multiple sclerosis occur due to destruction of myelin, a substance that surrounds the cells of the nervous system. The main role of myelin is to facilitate the transmission of nerve signals at the level of central nervous system and between the CNS and all the other nerves spread throughout the body. Myelin also has the role to protect nerve cells, forming a coating that surrounds their surface. In most cases, the destruction of myelin characteristic to multiple sclerosis takes place fast and generates a wide range of dysfunctions of the nervous system. The process of myelin destruction is irreversible, and most existing medical treatments can only slow down this process, being unable to stop it. Due to the fact that multiple sclerosis can cause a multitude of dysfunctions in various sections of the body, the type, intensity, and duration of symptoms differ from a patient to another. Patients with multiple sclerosis may experience numbness, tingling or pain in the muscles, muscular weakness and fatigue, muscular spasms, decreased visual acuity, blurred and double vision, frequent urination, constipation, decreased sexual function, poor balance, nausea, short-term memory loss, decreased judgment, poor concentration, and so on. The list of multiple sclerosis symptoms is very long, and such manifestations may either occur together or separately, depending on the levels of the nervous system which are affected by the disease. The good news is that patients with multiple sclerosis who receive the adequate medical treatment can regain control of their bodies and live active, normal lives. Although they can't reverse the already existing nerve damage nor completely cure the disease, most multiple sclerosis treatments can substantially alleviate symptoms and prevent the occurrence of severe complications. Factors behind the progression of multiple sclerosis. Multiple sclerosis is a form of autoimmune disease that often causes irreversible impairments at different levels of the nervous system. At present, multiple sclerosis can neither be prevented nor completely cured. However, the existing treatments are used to slow down the progression of the disease, prolong the periods of remission, ease the symptomatic flare-ups, and prevent the development of further complications. The main factor responsible for the development of multiple sclerosis is inappropriate activity of the immune system. While the normal immune system produces antibodies that fight against antigens, foreign infectious agents, in the case of multiple sclerosis, the immune system becomes dysfunctional and turns against healthy body cells. The compromised immune system can no longer distinguish between healthy normal cells and antigens, triggering repeated attacks on the body's nervous system and destroying the nerve cells' protective cover called myelin. The destruction of myelin, protein that has a series of vital roles at the level of the nervous system, determines serious impairments of the central nervous system and peripheral nerve tissue. Myelin surrounds the axons, filaments that are responsible with the transmission of electric impulses among nerve cells, facilitating the transmission of information between nervous cells. When the myelin cover is destroyed, the signal transmitted at the level of the nervous system are disrupted, thus causing a series of neurological symptoms in patients confronted with this type of disease. Although in the past medical scientists believed that multiple sclerosis only involves the destruction of myelin, recent medical investigations have revealed the fact that the axons are also attacked by the dysfunctional immune system. Axon destruction begins in the incipient stages of multiple sclerosis and it is considered to be the main reason for the irreversible character of the disease. The spontaneous periods of remission experienced by most patients with multiple sclerosis are believed to occur not as a result of temporary decreased autoimmune response, but as a result of accentuated remyelination, repairing of the myelin, at the level of the nerve cells. However, the beneficial effects of remyelination are later surpassed by the undesired actions of the immune system in the periods of relapse. Intrigued by the process of spontaneous remyelination that occurs in the periods of remission, medical scientists are currently working to stimulate and enhance this process at the level of the nerve cells in patients with multiple sclerosis. Extra stimulation of the nervous system's production of myelin, corroborated with immunosuppressive treatments, may provide an efficient cure in the near future. Multiple sclerosis prognosis: understanding the disease and making a difference in your future. Once a person has been diagnosed with MS, the next question most people ask is, what is my prognosis with multiple sclerosis? If they have heard about the disease, many have heard only the worst-case scenario and expect to only have a few years at best to live. Due to the nature of this particular disease, the prognosis for the majority of patients is that they will live for many years. In many cases, their lifespan is at worst only likely to be shortened by a few years. Defining the prognosis of multiple sclerosis. The very nature of this disease and the fact that it does not seem to affect any two people in the same way can make predicting prognosis for multiple sclerosis very difficult. However, there are certain factors that can help doctors determine a short-term prognosis that can be adjusted depending on how rapidly the disease progresses. To start with, less than 55% of all people diagnosed with MS are known to have the most severe form of progressive MS. Of all people diagnosed with multiple sclerosis, some 10 to 20% are found to have the benign variety, which progresses so slowly that any progression may not even be detectable. A recent study shows that at least 7 out of every 10 patients who are diagnosed with MS will still be alive 25 years after they are diagnosed. This is close to the 9 out of 10 people of the same age who do not have the disease. Factors that can affect a multiple sclerosis prognosis. There are many factors that can affect the prognosis of multiple sclerosis. Whether you are a male or a female makes a difference, as the disease has been shown to shorten the lives of men by an average of 11 years and women by only 6 years. In most cases, when you are diagnosed with the benign type of MS, your chances of becoming disabled are relatively small. Those who do experience some level of disability in the first 5 years are likely to see a 75% increase in the disability by the time 10 to 15 years has passed. There are actions you can take to improve your multiple sclerosis prognosis beyond the drug therapies that your doctor is likely to put you on. While the disease is likely to make you become easily fatigued, regimen of exercise has been found to help slow down the progression and reduce the impact of any exacerbations you might experience. Even if your symptoms include partial paralysis, you can still continue to exercise. Eating a well-balanced diet will have a major impact on your prognosis. Eliminating overtly processed foods and red meats can help reduce the amount of inflammation in your body. Stick to leafy green vegetables and fruit, as well as lean meats and foods that are high in omega-3 fatty acids, has been proven to have a major impact on relapses and how long you can expect to live comfortably. Multiple sclerosis supplements. Throughout the years, medical professionals and patients alike have discovered many effective multiple sclerosis supplements. Most individuals that develop this condition are placed on a medication therapy. The purpose and intent of prescription drugs when used in conjunction with multiple sclerosis is to slow the progression of the disease itself and to soothe the symptoms that are commonly experienced with multiple sclerosis. Prescriptions may come in the form of pills, tablets, capsules, liquids, and many even come in the form of a shot that must be administered several times weekly. Many find that these medications are expensive, ineffective, and many are troubled by the side effects associated with them. For this reason, multiple sclerosis supplements have gained in popularity. Here, you will learn about some of the more popular supplements available to the MS patient and the benefits associated with those supplements. The benefits of taking supplements. If you are suffering from multiple sclerosis, it is important to understand that there are many benefits associated with taking supplements. Not all doctors will encourage the use of alternative forms of treatment for this progressive disease, but it is important to consult with a medical professional prior to taking any type of supplement. While speaking with your doctor, you may want to present some facts pertaining to the benefits associated with the supplements that you are interested in. The following represents some of the most common benefits associated with natural supplements. Many multiple sclerosis patients have a difficult time when it comes to the body absorbing nutrients from the food products that they consume. If you take the right supplements, your body may be able to withdraw the nutrients that it requires to function appropriately. If you suffer from MS, it is important to understand that your immune system does not react as it should to protect you. As a matter of fact, it acts in the opposite manner. It actually attacks you. If you take supplements that focus on the immunity, this may cease to happen. Unfortunately, inflammation is a common symptom of multiple sclerosis. Most doctors will prescribe medications that will reduce inflammation in the body, but many of these may eat at the lining of the stomach and cause gastrointestinal complications such as ulcers and irritable bowel syndrome. There are certain supplements that will actually work to reduce inflammation naturally and without any uncomfortable side effects or potential risks. One of the most common complaints associated with multiple sclerosis is decreased energy levels. Many supplements may actually provide you with the natural boost that you need to make it through each day. The best supplements. There are many multiple sclerosis supplements. It is important to only choose those that assist in eliminating the symptoms that you find to be uncomfortable. It has been established by medical professionals that those with MS should take magnesium. It is also important to have a lot of calcium and even vitamin D in the body. Fish oil supplements, evening primrose, zinc, copper, and B vitamins are also quite beneficial. If you are unsure of what supplements will benefit you the most, you may be interested in purchasing products that contain multiple vitamins and multiple minerals. The benefits of multiple sclerosis therapy. Multiple sclerosis is an inflammatory neurological disease that can generate a wide range of physical and psychological symptoms. Multiple sclerosis involves the deterioration of myelin, a substance that surrounds the body's nervous cells. Myelin has a very important role in the transmission of nervous impulses, and if the substance is affected, the entire activity of the nervous system is seriously compromised. Although the actual causes of multiple sclerosis remain unknown, there are several hypotheses that present genetic abnormalities as the main factors responsible for causing the disease. Medical scientists believe that multiple sclerosis occurs on the background of inherited genetic predispositions, and environmental factors are suspected to be triggers of the disease. Some hypotheses also introduce viral infections in the scenario, although infections with viruses don't seem to contribute to the development of the disease. Multiple sclerosis can affect the body on different levels. The majority of people with multiple sclerosis suffer from dysfunctions of the muscular system, while others also develop neuropsychological dysfunctions. Multiple sclerosis usually generates a wide range of symptoms: body weakness, pronounced fatigue, muscle numbness, poorly coordinated moves, poor balance. People affected by multiple sclerosis can in time experience decreased visual acuity, mental states of confusion, and even short-term memory loss. People with multiple sclerosis can also suffer from depression, which is common in more than 80% of patients with the disease. Although there is no cure for multiple sclerosis, most medical treatments can alleviate the symptoms generated by the disease, also preventing their reoccurrence. However, the majority of medications prescribed in long-term multiple sclerosis treatments, beta interferon and corticosteroids, can generate many side effects, causing additional damage to the body. Hence, it is best to avoid following long-term treatments with potentially harmful drugs. In many cases, multiple sclerosis therapies can ameliorate physical symptoms just as well, without using any drugs, considering the fact that most symptoms generated by the disease are linked to the musculoskeletal system. The majority of multiple sclerosis therapies are focused on improving muscular mobility and tonus through physical exercise. Multiple sclerosis therapy through exercise can help patients regain their strength, coordination, and balance, alleviating muscular pain, numbness, and stiffness. The majority of multiple sclerosis therapies involve recuperative physical exercises and medical gymnastics. Other forms of multiple sclerosis therapies include recreational physical activities, such as swimming, jogging, or the practice of different sports. Most people who have followed such multiple sclerosis therapies have experienced an amelioration of their physical symptoms and have improved their overall health condition. Although medical treatments are required for most patients, people who follow multiple sclerosis therapy need smaller doses of medication. Combined with an appropriate diet and a healthy lifestyle, multiple sclerosis therapy through exercise can be very beneficial. Tips for a multiple sclerosis diet. A good multiple sclerosis diet is believed to help control and possibly eliminate many of the symptoms that come along with the disease. This can help slow the progression of the disease. While you should check with a doctor for specific suggestions or guidelines, there are some basic tips to a multiple sclerosis diet. A key factor in a healthy multiple sclerosis diet is to eliminate all gluten. In general, you should avoid eating anything with flour, but you can check package ingredients if you are unsure of their content. Many diets besides the multiple sclerosis diet do not allow gluten, so this is now easily found on many packages. Avoiding wheats, barley, oats, or rye is another way to cut gluten. For a successful multiple sclerosis diet, you should also limit or avoid animal fats, including dairy products and margarine. Olive oil, sunflower oil, and safflower oil are suitable alternatives for cooking or salads. For good digestion, you should try to avoid fried foods in general. Avoid highly saturated fats in your multiple sclerosis diet. White meat, skinless chicken, seafood, and fish are the best meat choices. Make sure to always completely remove any fat. Try to replace the saturated fats you cut out with unsaturated fats. Anyone, but especially those on a multiple sclerosis diet, should try to completely eliminate refined sugar. There are many healthier alternatives. Honey, fructose, or natural unsweetened fruit or vegetable juices would be ideal for a person on a multiple sclerosis diet. Obviously, any foods you are allergic to should be cut from your multiple sclerosis diet. If you are unsure of allergies, try consulting a doctor or allergy specialist. You may also try eliminating all of the most common problem foods from your diet, and after 2 weeks, bring them back one at a time. If you have a bad reaction to any food, then you should probably eliminate it from your multiple sclerosis diet. You should increase the amount of fresh vegetables and fruits in your multiple sclerosis diet. Try to always eat freshly cooked food when you must cook it. This will increase the amount of vitamins and minerals your body absorbs. This will help to make up for some of the nutrients you lose by cutting certain things from your diet. Vitamin supplements may also be beneficial or even necessary for your multiple sclerosis diet, but you should consult a doctor to make sure you take the right vitamins. Always drink lots of water in your multiple sclerosis diet. It is very easy for a person with multiple sclerosis to become dehydrated, so make sure to drink at least 8 large glasses of water every day. As strange as it sounds, this may help to improve the incontinence that many people with multiple sclerosis suffer from. These tips for improving your multiple sclerosis diet are intended to help you control many common problems such as fatigue, incontinence, and constipation. Adjusting your multiple sclerosis diet may also help to avoid making other problems worse. Many of these tips are included in other diets, and even people without special dietary needs may benefit from following these suggestions. Understanding multiple sclerosis subtypes. Depending on its patterns of progression, as well as the intensity and frequency of its generated symptoms, multiple sclerosis can be categorized in 7 different subtypes. The first subtype of multiple sclerosis is the relapsing remitting multiple sclerosis, RRMS. the most common form of the autoimmune disorder. According to statistics, more than 80% of all multiple sclerosis cases are of the relapsing-remitting subtype. This subtype is characterized by phases of symptomatic remission followed by phases of relapse, characterized by sudden intensification of symptoms. The duration of the phases of relapse and remission vary from a patient to another, lasting anywhere from several weeks to several years. The second subtype of multiple sclerosis, primary progressive multiple sclerosis, PPMS, accounts for around 20% of all multiple sclerosis cases. The major characteristics of this subtype are gradual progression of the disease, with very short phases of remission. The third multiple sclerosis subtype is similar to PPMS subtype and is called secondary progressive multiple sclerosis, SPMS. Patients with primary progressive multiple sclerosis have a 50% chance to eventually develop secondary progressive multiple sclerosis. The fourth subtype of multiple sclerosis is called progressive relapsing multiple sclerosis, PRMS, and is characterized by gradual progression with frequent phases of symptomatic exacerbation. The fifth multiple sclerosis subtype alternates between the primary progressive, secondary progressive, and progressive relapsing forms of the disease. The sixth multiple sclerosis subtype is benign multiple sclerosis, characterized by an initial symptomatic flare which can be followed by slow or no progression at all. The seventh and last multiple sclerosis subtype is also very rare. It is called malignant multiple sclerosis and involves rapid progression and very intense symptoms. This subtype is in most cases deadly. Various forms of multiple sclerosis treatment. Multiple sclerosis involves an inflammatory process at the level of the central nervous system, resulting in the destruction of myelin. Myelin is a substance that surrounds the body's nervous cells, facilitating the transmission of nervous impulses between neurons. If the integrity of the nervous cell's myelin is compromised, the transmission of nervous impulses between neurons is perturbed, causing serious neurological dysfunctions. Multiple sclerosis primarily affects the body's ability to respond promptly to external stimuli, sensorial function, decreases the mobility of the musculoskeletal system, motor function, and reduces mental performance, cognitive function. People affected by multiple sclerosis can in time suffer from serious neuropsychological disorders, such as depression, short-term memory loss, compromised judgment, emotional instability, mania, and even dementia. Multiple sclerosis can also affect the activity of the internal organs, causing renal dysfunctions or disorders of the gastrointestinal tract. Multiple sclerosis can affect the entire activity of the body, and people who suffer from this disease can develop serious physical and neuropsychological conditions. The progression of multiple sclerosis is intermittent and unpredictable. People affected by multiple sclerosis can experience periods of remission, followed by states of relapse. The symptoms generated by the disease occur in episodes or flares. Although most of the damage caused by this type of neurological disease to the organism can be minimized and reversed with the means of an appropriate multiple sclerosis treatment, modern medicine doesn't hold the cure for this particular type of disease. The majority of multiple sclerosis treatments available today are focused on extending the periods of remission and on reducing the duration and intensity of the symptomatic flares, being unable to completely overcome the disease. The most effective medication used in multiple sclerosis treatments is beta interferon. This substance is commonly used in multiple sclerosis treatments for helping in the process of myelin reconstruction. By using beta interferon in multiple sclerosis treatments, doctors are able to control the evolution of the disease and to fight the actual causes of its generated neurological dysfunctions. Considering the fact that the disease also generates muscle weakness, inflammation, pain, and rigidity, the majority of multiple sclerosis treatments include non-steroidal anti-inflammatory drugs, which can help in alleviating the symptoms experienced at the level of the musculoskeletal system. Corticosteroids are also commonly used in multiple sclerosis treatments, as they can minimize the intensity of the physical symptoms experienced during the stages of relapse. Multiple sclerosis treatments often include anticonvulsants, analgesics, mild sedatives, and muscle relaxants in the periods of symptomatic exacerbation. If patients developed internal disorders due to inappropriate activity of the nervous system, multiple sclerosis treatments can also involve the use of medications such as anticholinergics, drugs that reduce bladder spasms, urinary tract antispasmodics, and antidiuretics. For improving mental performance, memory, and concentration, multiple sclerosis treatments can also include selective serotonin reuptake inhibitors and central nervous system stimulants. These medications are able to ease the generalized state of mental fatigue characteristic to people affected by multiple sclerosis. If patients suffer from serious psychological conditions, such as depression or emotional instability, multiple sclerosis treatments can also involve the use of antidepressives and mild sedatives.